In this presentation, I'd like to talk about applying the rules of engagement. So what we know from experience and evidence in published literature about what works for men when engaging them in health services and health programs. And in particular, I want to focus on programs that have very much adapted a hands-on approach and used physical activity as a hook. Some of the first work that looked at bringing health interventions into the sporting arena were conducted by Steve Robertson, Andy Pringle and others in Leeds, and they looked at Premier League football clubs, and they used these clubs as a setting to engage men in their health and to deliver health promotion interventions. So it became evident from these types of studies that physical activity was a really useful hook, and sport was a really useful hook to I suppose engage a captive audience, men who were there anyway, and men who already had an allegiance to these clubs. And I suppose from these earlier studies, you can just really see the potential that has been realised in this area as I move through the next few slides. The Football Fans in Training project was conceived by a team of researchers led by Kate Hunt in Glasgow, and was supported by the Scottish Premier Football League Trust. And the aim of this particular programme is to support men and women to get fitter, become healthier, and to go behind the scenes at their local club, and it's all for free. It's specifically a weight loss programme, so they did want to attract men and women who had a waist circumference of at least 38 inches. Now, notably, while the programme is promoted for both men and women, they did offer men-only groups and women-only groups. So and they've got some really fantastic findings from these men-only groups. It was a 12-week programme. It allowed fans of the football clubs to get behind the scenes. They got to look at their club. They got to be trained by selected club coaches. They were able to have a nosy at the trophy cabinet, have a chance to talk tactics in the dressing room, and even bump into a player or two. So the programme itself was really, the language that was used, the marketing that was used was really towards the fans of these football clubs, and it was strongly supported by the clubs themselves in terms of getting access to the facilities, to the staff and to the players. So, as you can imagine, young boys who grow to be these men supporting this club, getting this opportunity to go in and to actually use these facilities and to get this gesture back from the club was very meaningful for these guys. And if you'd like to find out more about this, the website is there, and I would strongly suggest that you do, because they've got some really good footage there in terms of how the programme was delivered and the experience of the men. As I said, the research team have produced a plethora of literature reporting on this particular study, and the final report is here on the left. What they found was they engaged a total of 800 men. I think there was 760 actually in total, and they followed these men for up to 52 weeks post-baseline. Again, the group that they targeted had a profile of overweight and obese. They had to have a BMI of greater than 27 kilograms per meter squared. And what they found at the end of this study was they achieved the NICE guidelines of a 5% weight reduction, and this was maintained up to 52 weeks. If you read further on any of these papers, you'll find that they also looked at self-reported measures of lifestyle behaviours. They looked at self-esteem. They conducted qualitative studies to get the broader impacts of this programme on the men in their lives. And I suppose in just a couple of sentences, there have been significant mental, social and physical benefits for participating on this programme, and researchers and practitioners alike have learned an awful lot with respect to the particular hook that is physical activity that appealed to these men. And this is just an example of how one of the football clubs, which is Rangers, market the football fans and training program to their fans. And as you can see, it's really quite effective. They're there in the kit, they're on the pitch, they're represented as a team themselves rather than a men's health group, and they were able to say that the fans of the Rangers football fans and training course have lost an incredible combined 59.5 stones. So again, there's a real clear message to other fans that this is a tangible outcome that can be achieved, and they're all looking healthy and smiling and happy. So as I said, this is just an example of how one of the clubs was marketing the programme. And it's not surprising then that with such positive outcomes that Football Fans has actually evolved into a Eurofit project, and there are now 5 countries involved in this project. It has evolved into a physical activity program rather than a weight loss program, so there's slightly different results coming from this, but the full report should be available in early 2019. And I know that beyond the Eurofit project, other jurisdictions have looked for ways and means in which they could replicate this model in their own country. So here's an example of Hockey Fans in Training being delivered in Canada. I'm aware of RU Fit, which is associated with the New Zealand Rugby Association, and as I said, that there are other sporting organisations and in other countries who are learning from these experiences and adopting this Football Fans in Training model to engage this captive audience of men who are already fans of their clubs. In Ireland, we also have learned hugely from the FIT experience, but we have not worked with the same model. Unlike the professional sporting organisations in other countries, we don't have that same structure in Ireland. We do, however, have another structure that we use to promote physical activity in the general population. So in every county in Ireland, there is a local sports partnership, and the remit of this partnership is to improve physical activity levels within their county. So using this particular structure, we adapted the FIT model into a community-based model and applied it in an Irish context. Unlike FIT, it was not a weight loss program. It is a physical activity program, and the overall aim of the program is to improve the health and well-being of participants. And I'd like to tell you a little bit about this program now, and in particular make reference to how the rules of engagement, the rules identified in Engage, Ireland's National Men's Health Training Programme, and the evidence that currently available to us about good practice when engaging men in programs such as this. So I'd like to make reference to how we used that information and integrated it into the model of delivery here in Ireland. So in the pre-delivery phase of this project, we initially had to lay down the foundation. And critical to this foundation was identifying the key partners available to us to deliver this program. In the lower part of this particular slide are the 8 sports partnerships that agreed to take part in the intervention that is Men on the Move. 4 of these sports partnerships were going to get the intervention in year 1, and the other 4 partnerships were going to act as a comparison and waiting group and get the program in year 2. In addition to these service providers, we also got support from our National Health Service, from Sport Ireland, from our Heart Foundation, and from an NGO called Get Ireland Active, and the Irish Cancer Society, and the Men's Development Network, and a number of academic institutions were involved in the research arm of this particular project. So the programme itself had a number of components, and each component, as you can see in this slide, was assessed for its gender sensitivity, was based upon a behaviour change strategy, which is a social cognitive theory, and the specific targeted construct was identified relating to each particular component. Similar to the Football Fans in Training, the Men on the Move programme was a 12-week physical activity programme. Unlike Football Fans in Training, the programme in Ireland was delivered 2 evenings a week for 1 hour. Football Fans in Training was 1 evening a week for 90 minutes. The decision for 2 evenings a week was because we wanted to increase our reach, and hopefully by offering it over 2 nights rather than 1, more men will be able to attend who may have a fixed commitment on 1 night a week. So as you can see, if we look at the interventions here, or the intervention components here, it was a structured group exercise session. There was 40 minutes dedicated to cardiovascular exercises and 20 minutes for strength and conditioning. In week 6, a workshop on diet was delivered, and around week 8, a well-being workshop which really focused on mental well-being and stress was delivered. These workshops were delivered by members of our health services. A 24-page information booklet was developed and given to each man at registration, and this booklet contained a physical activity diary, dietary, physical activity, and stress and other areas, health-related areas, and again, the booklet was gender sensitized and it was literacy proofed to ensure that the messages were appropriate for men and that men with a low reading level could understand the messages in the booklet. Each man received a measurement and a wallet card at registration. So this is a small card that they could take away the results at each of the data collection time points so they could monitor their own progress. On the first session of the programme, each man was given a pedometer so that he could set targets for himself, physical activity targets for himself in between sessions. The practitioner contact with the men was quite high at particular times of the programme, and men received text messages to encourage them to come to the programme each evening, and again around data collection time points they were encouraged to come and get their measurements taken. At the end of the 12-week programme, a celebration event was set up in each county. Each county had 3 groups, and all groups came together for the celebration event. In most instances, this celebration event was a 5-kilometre challenge that men could run, walk or jog and move from A to B at their own pace. And for many this was a really positive experience in terms of demonstrating to them a very significant tangible outcome that they could achieve at the end of this programme. And here's an example of some of our branded materials. So here's the health information booklet. You can clearly see that the images of the men are of normal, regular men living in Ireland to whom our target group could relate. And here is the front and back of the wallet card. So you can see that the identity is with the local sports partnership in each county, and there's space for men to record their data across all time points. The vision for the partnership network overseeing this project was that Men on the Move would be scaled for delivery at a national level, and during the planning phase a number of checks were made to ensure that the planning and delivery would be compatible with scalability, and some of these are listed here. And what I'd really like to highlight to you with respect to the rules of engagement was that the programme itself was affordable. So the first 12 weeks, which is the programme, was free for the men who attended, and we do know that post the 12 weeks men have contributed themselves €2 or €3 a week to pay the physical activity pay the physical activity coordinator directly and to keep the groups going. The program was also really simple. Men only needed to bring a pair of runners and comfortable clothing, and everything else was there for them. Outdoor facilities were used within their own communities, and there was constantly an educational component about how they could be active in various places within their community. And all of these underpinned the feasibility of delivery in the real world. In the pre-delivery phase, a significant amount of time was also given to building capacity within the delivery system. So this is the LSP network. It would also be the other health service providers going into the room to deliver the workshops, but also the other community service providers who were partnering with the local sports partnerships in each community to host the physical activity program. So all of these service providers received the Engage program, which is Ireland's National Men's Health Training Program, which was modified slightly for Men on the Move. And they also received data collection training because the service providers on the ground were actually hands-on in collecting the data for this study as well. And maybe just to put a number on that, or to give you an idea of the scale of this project. So across the 8 counties in Ireland, in both the intervention and the comparison and waiting groups, a total of 118 people from a variety of different organisations. So public bodies, physical activity bodies, health bodies, community and voluntary organisations have been involved in the development, implementation and evaluation of this Men on the Move project. This slide is a succinct overview of the data collection for the Men on the Move. So as you can see, there are 4 comparison and waiting counties, 3 intervention counties. The aim in each county was to establish 3 groups of 30 men, which would leave 360 men per group, and this mirrors the Football Fans in Training target. Data was to be collected at baseline, which was the registration for the programme, the end of the programme, which is 12 weeks, at 26 weeks post-baseline and at 52 weeks post-baseline. And here is a list of the quantitative measures that will be measured at all 4 time points. And because it was a physical activity programme, physical fitness was our key measure, and it was the time to complete 1 mile. We also measured weight, body mass index, waist circumference, and we had self-reported measures for general health, dietary, smoking and alcohol habits. We used WEMWebs to get an assessment of mental well-being, and we also used a social integration scale. 42 participant interviews, one-to-one participant interviews were conducted with the men themselves to get a sense of the broader impact of their participation on their health and well-being. We also interviewed 11 of their significant others to see if there were any ripple effects on the broader family and community with respect to the engagement of the men. And we also interviewed, through focus groups and one-to-one interviews, several of the practitioners across all 8 counties to get an understanding of the processes involved in delivering this programme effectively. And the final part of the pre-delivery phase was actually in recruitment. So this is the poster that went live on social media and in hard copy across communities in the 8 counties. And as you can see here, it really sets the tone and feel for the type of programme that was being offered. It was about engaging men who wanted to start exercising. The tangible benefit was that they could feel fitter and have more energy. And we highlighted the fact that it was free, only for men, and it was going to be in their local area. The recruitment strategy was robust. We worked with local media stations, we worked through local community groups and their databases. We established partnerships with local community organisations who would host the Men on the Move programme in each community. And we set up registration evenings in those organisations. There were a minimum of 7 service providers present on any evening to welcome men, offer them the cup of tea, which is a wonderful icebreaker in an Irish setting, and to conduct these measurements and to allay any concerns or fears that men may have about participating in the programme, and normalising those fears, introducing them possibly to neighbours and acquaintances within their communities, and effectively establishing a really male-friendly environment at those registration evenings so that men were supported to come along the following week to the programme. And for any of you who would like more detailed information on the protocol adopted for the pre-delivery and data collection and analysis phases of this particular project, it's all detailed here in this particular publication. So the first and most pressing question would be, did the programme engage those for whom it was intended? Well, here are some of the baseline characteristics of the group who showed up across the 8 counties. So we are including all 927 men in this who engaged at registration evening across the 25 sites in 8 counties in Ireland. And if you remember, we had hoped to recruit 720, which would be 360 in each group, but we actually recruited 927, 487 I think in one group and the remainder in the other. And as you can see here, there's quite an age range from 19 years of age up to 87 years of age, and an average age of 50.8 years. Their waist circumference has an average of 105 centimeters, and again we know anything above 100 centimeters increases risk for men. And we've an average weight averaging 72 kilograms. BMI, despite the fact that it is not a weight loss study, we have an average BMI of 30.5, which would collectively put this group into the obese category. And the time to do 1 mile was an average of 13.3 minutes. However, it ranged from 6 minutes to up to 30 minutes. And just to flag here that while we were discouraging men who were currently active from coming to the programme, we did not use that as an exclusion criteria, because we felt that perhaps those men were coming to the programme to address another health issue that they may have. And for many men, it may have been a health issue, or they may have been experiencing social isolation. So we didn't exclude these men from coming and participating on the programme. Notably, it is evident from this data here that several of the men who came at registration were quite unfit. As you can see here, of the 927 men who showed up, only 10% of the men were of normal weight, with the vast majority in the overweight or obese categories. And according to their waist circumference, 54% of the men, or 54.5% of the men who showed up had a waist circumference greater than 102, which is indicative of a high risk of cardiovascular disease. And as you can see here, when looking across a variety of risk factors for cardiovascular disease, you can see that many of the men had risk factors across these areas. So for example, nearly 57% of the men engaged in physical activity less than 3 days a week. 13% of the men who showed up were smokers. Notably, this is less than the national average in Ireland, which may be indicative that a physical activity programme simply doesn't appeal to men who smoke. And here you can see this data summarised as the number of risk factors that men present with. And as you can see here, 36% of the men in the group who showed at registration had 2 risk factors for cardiovascular disease, and almost 10% had 3 risk factors. So while it's evident that we did achieve engaging the men that we wanted to bring onto the programme, the next really relevant question was, did they keep coming? Did they actually continue to come to the programme and possibly get benefit from that? So of the 489 men who were in the intervention group, we know that 70% of those attended at least 50% of the program. So because our program was 2 nights a week, we can interpret this that 70% of the men attended our program at least on a weekly basis, which we would call a measure of success. So what was the impact of the program on those men who attended the program? And for the remainder of this presentation, I'm only going to look at the objective measures, but I will direct you to where you can find information on the qualitative data that we collected as well. But before I talk you through some of the objective data, I'd like to take a moment to talk about the participation flow through this study. And as you can clearly see on this slide, dropout was a significant issue for us in this study. I spoke earlier of our desire to develop a model that could be translatable to real-world practice. So we adopted a number of measures to ensure that that was the case. And for example, because the service providers were collecting the data, it wasn't possible or feasible or desirable for them to collect data in people's homes, as was the case with football fans and other studies where they were striving to improve attrition at follow-up time points. So as a result, you can see that at each time point we struggled to maintain attrition. However, the greatest dropout was within the first 12 weeks, and thereafter, between 26 and 52 weeks, we did manage to be relatively consistent with our numbers. And we have accounted for this in the analysis to follow. So if we look at the effect of the program on weight initially, we can clearly see that there was a significant reduction in weight at 12 weeks, which was consistent to 52 weeks for the intervention group, but no change in weight was observed in the comparison in waiting group. Likewise, with waist circumference, we can see that there is a reduction in waist circumference in our intervention group, and this is maintained up to 52 weeks, and no change was observed in our comparison group. Notably, the waist circumference is just over 4%, and we know that with each centimetre reduction in waist circumference, there is approximately a 2% reduction in cardiovascular risk. So we estimate that using this particular measure, that there is an overall reduction in cardiovascular risk of in the region of 9% for the intervention group, but no change observed in the comparison and waiting group. Similar to weight, we see reductions in BMI, again significant for our intervention group but not our comparison and waiting group. And notably, as it was a physical activity program, we would have hoped to have seen improvements in the time to complete 1 mile. And as you can see here, we can see that the time it took for these men to complete that 1 mile significantly reduced, and the improvements were maintained up to 52 weeks. We calculated the metabolic improvement in their performance and can note that there was on average a 2-MET improvement in their physical aerobic fitness, which equates to almost a 30% reduction in cardiovascular risk. So when you couple this with the waist circumference variable, we can conclude that the cardiovascular risk in this group was reduced anything from 9 to 30% as a result of the intervention. Given the success of this program through this large-scale study in such a small country, you can see here that these are the 8 counties involved in the study. This is their geographical spread throughout Ireland. The Republic of Ireland is not a very large place, so to have 8 counties experience this program in such a positive way, it has created momentum for the programs to continue. So we know that currently in these 8 counties there are 40 Men on the Move groups up and running, engaging approximately 820 men. As a result of the cardiovascular risk reduction found in this study. A national coordinator to roll this project out nationally has been appointed within the HSE. So in many ways it's a really good news story that we're very proud of here in Ireland, because it is an example of translating research evidence into impact on the ground, which is really what matters at the end of the day. And it's also great to see service providers who pioneer initiatives and innovations to improve health and well-being be rewarded for the work and be recognised for the work that they do. So the idea of Men on the Move was originally conceived in Mayo by the sports partnership there, and it evolved through their practice and was shared across these 8 counties, and they really did pioneer the initial program and greatly supported this project and the development of the evidence to underpin the decision for national rollout. So as I said, it's fantastic to see service providers being acknowledged and recognised for their work, but also for them to know that their work can translate across the country and have a far greater impact than just benefiting a smaller community in one county. And to conclude, I'd like to acknowledge the research team that worked in partnership with the service providers to deliver this project. And I'd also like to bring your attention to my contact details there. I'm pcarroll@wit.ie, and we have a number of publications arising from this work, including the full report, an executive summary, and journal articles. So if you would like any of these resources to read further about this project, I'd be delighted to share them with you.